Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Atropine and the bronchi. Action on bronchi. Atropine is the oldest bronchodilator. Actually, the agents like anticholinergic drugs like ipratropium and tiotropium bromide are more selective and more potent, and they are longer acting than atropine. And among these, actually, tiotropium is the drug of choice for chronic obstructive pulmonary disease or chronic bronchitis or emphysema or psychogenic asthma. Tiotropium bromide is the drug of choice. Side effect of atropine is it can cause side effect like dry mouth can occur because of this atropine, and also yeah, tiotropium bromide is used as drug of choice for COPD and asthma. Tiotropium bromide is more M3 selective, is more for tiotropium bromide when compared to ipratropium. So that is the reason why tiotropium bromide is the drug of choice for chronic obstructive pulmonary disease and chronic bronchitis emphysema.
thank you and thank you for watching.